Good afternoon and welcome to the Senior Moment. This is Connie Clark with Home Helpers. And this afternoon in the studio with me, I have Maze Vu, and she is with Northwest. Speak clearly here, Connie. Northwest Health Systems. And she's a pharmacist. Welcome.
Thank you.
First off, the question. You are not what I would typically see in a pharmacy. If I walked in, the pharmacist would be a male, probably in his 50s, up there with the graying hair, and you were not that. So how did you happen to get into this line of work?
Well, it started, when I was a little girl, and my grandma, she had a lot of cultural beliefs and spiritual belief in what healing was. And I always thought to myself that, oh, Grandma, don't believe in that. But, and so that's why it geared me to go into pharmacy school to learn about medication and Western medicines. And then throughout pharmacy school, the more I was getting through to finishing pharmacy school, I realized how much more right my grandmother was. So,
It's interesting. The older we get, the wiser they get,
It is.
Oh, my goodness.
So that's how it started, was I wanted to prove a point to my grandmother that, that Western medicine was the best way of healing. But by the time I got done with pharmacy school, I realized that she was right.
She was sitting back there smiling, right?
Exactly, yeah.
Well, one of the questions that I have then, again, my perception, my skinny little world perception, is the pharmacist stands back there and you walk in and you hand them the piece of paper with your prescription on it and they give you the pills and you walk away and that's all they do. But that's not the case nowadays. So tell me some of the other things other than going back and getting the bottles and putting the pills in there and handing it to you that they do.
There is so much more that pharmacists do today. And that's true. Pharmacists still do that, but
so that hasn't changed.
That hasn't changed. But behind the counter, we're running drug reviews, making sure that new prescriptions are not interacting with current prescriptions that you're taking. We're reviewing drug side effects to make sure that if there's anything that is serious, we would bring that up in consultation.
So it's important then that when you are getting medications, you only use one place, or if you're using multiple sources for that, they're all aware of all your prescriptions.
That's correct.
Because there's a lot of medications that counteract each other.
They do.
And if you don't know that, there's no reason for you to take them because they're not doing you any good. Mm-hmm. Or it could be dangerous.
It could be. And it makes it difficult on our end because we're receiving a prescription, and oftentimes we have an incomplete patient profile where we're not sure all the medications they're on. And keep in mind, we have a list of medications that are prescribed, but we're not aware unless if you told us what herbal medicines you're on, over-the-counter medications, those could also interact with the drugs that you're taking.
So when you go to your doctor's office and you tell them, I'm taking ginkgo and a baby aspirin and all this, if they don't pick up on that, or if they don't know what someone else has given you, those things could harm you.
It could.
So when you go to your pharmacist, you need to sit down and, I guess, make a list of all the other stuff you're taking.
That's correct.
And if you decide, oh, I think I need to start taking this, and you go buy it at the health food store, it might be a good idea to tell your pharmacist you're doing it.
It would be a really good idea. And if you ever had any questions on, I saw this on a commercial or a friend suggested this to me, always feel free to bug your pharmacist. Ask them, him or her, for any questions that you might have on it.
Yeah, because drug companies are really doing a lot of major advertising of specific drugs. And you might see something on TV and go, oh, yeah, I want that.
Yeah.
I have that condition. I should be taking that. But that may not be a good thing, So you do a comprehensive review of patients' medications. And you had mentioned something before we started about that some of the skilled nursing facilities actually have you do that.
Yeah, it's actually required federal law where every 30 days in a skilled nursing facility, a pharmacist is required to do a complete drug utilization review. So that means review the complete medication list and look for any inappropriate medications for our older adults. Anything that may be excessive, anything unnecessary. Those are things that they would review every 30 days. Now that request for having pharmacists to do that review now is actually leaking into long-term care facilities in a bit.
And assisted livings and that sort of thing?
Yeah, so we're seeing that trend where more and more folks are requesting that. But it's not quite required quite by law yet in an assisted living.
Okay, because they do administer the medications in assisted livings also, similar to like they do in the skilled nursing. And you had also said something to me before we started talking about that there were a number of states that pharmacists actually monitor the patients. Explain what that is.
Yeah, it is called collaborative drug therapy management, where a pharmacist has a collaborative practice, kind of like a contract between himself or herself and the physician, where the pharmacist is allowed to directly monitor, dose, prescribe a medication. So right now, when we think of pharmacists, we think of them as the pharmacist is allowed to dispense the medication, but they can't.
They're more reactive.
Yeah, exactly. They don't actually write the prescription. That's the physician's job. Well, now, in today's world, we are actually, as pharmacists, under a collaborative practice, allowed to do that. And so in about 45 states, we are allowed to do that. I know in the state of Washington, we are for sure. And the VA has a great example where they have the pharmacists monitor and manage chronic conditions such
like
as
diabetes,
diabetes, high blood pressure, any of those. And the pharmacist is allowed under that collaborative practice to monitor all the lab values that come back. They interpret that, they adjust the doses, and monitor and follow up with the patient.
So would they be the ones that would request the blood tests or that sort of thing, and then they would get the results back, or would the doctor request the lab work and then the pharmacist would receive the results?
It depends on what you have written in your collaborative practice, but if it is written in that it allows a pharmacist to request the lab work, that's fine too. And so it leaves a lot of flexibility for the pharmacist. So, and generally, if in the collaborative practice, if they do find any lab values that are out of the normal range, then they would contact the physician and let them know as well. So it is encouraging an interdisciplinary team model where the pharmacist, the physician, not only that, but social worker, nurse, and so on are allowed to work in this team to provide a holistic approach to healthcare.
And that makes sense because you actually see or talk to or interact with your pharmacist, I would think, more often than your doctor, because you're in communications with them when you're getting refills and that sort of thing. And that's more often than you actually go in and visit your doctor.
Yep.
So that makes a whole lot more sense. Is that something that has happened recently with the new healthcare laws, or did that go on before?
Some states have had it for a while.
Oh, okay.
Yeah, and in some states, it's just been a recently incorporated model. But and there are a few states that still don't have it. So it just, I don't know exactly how long ago that's been incorporated. But I think there are more and more models that are seeing that it works for the VA, and there are other models out there that are repeating it. So
very interesting. So pharmacists now are not just the pill dispensers; they're managing your chronic conditions. That wouldn't include, like, if I had the flu and come to you, you'd still have to go to your primary physician for that. But if it was something ongoing kind of thing.
Yep.
Interesting.
Yep.
And we were talking also about that, I'm trying to think of the right word, the format, if that's probably not the right word, of how the medication is, you can change. Like if it's normally a pill, you can make it into something else.
Now, are you talking about compounding?
Yeah.
Yes, pharmacists can compound now, and well, it's always been, I think, much more longer than this collaborative practice. Always been a part of what pharmacists do, is because a long time ago we were known as apothecary. I can't say it.
Apothecary.
Yeah, sorry. And then so now we have always been able since then to always manipulate medications into different formulations. So especially in today's world where certain medications are unavailable, it can be still made. It just has to be compounded. In cases where folks can't swallow due to different disabilities, we can make into creams, ointments, other formulations. And so we do a lot of that with hospice. A lot of our folks, our patients there, if they can't swallow, will make creams, suppositories even. So there's other options. And another big part of compounding is veterinary medicine. So for our pets, that if there's a formulation for humans that we take, and they may need a more concentrated form, or they may need a different dosage form because it needs to be applied on the skin versus taking it orally. Pharmacists can make that nowadays.
Now, when you had said, your pets, well, I've always envisioned, and everything I've always done when I go to my vet, they give me the prescription and I pay an arm and a leg for it. But you can actually take that prescription to a pharmacy a lot of cases? Because it's the same thing we take?
Sometimes, not all the time.
Okay.
So those are, sometimes if you ever had a question about if there's an equivalent drug to it, you could always ask a pharmacist too. But keep in mind it is different, and different animals absorb medications differently than humans.
So don't do it on your own.
Yes, exactly.
But that would be neat, and especially, I'm thinking about my dog, who, to try to get a pill down his throat, you have to really bait him with all kinds of good stuff around that pill, and then for some reason he eats all of it and spits the little pill out. If I could do something, so that I didn't have to go through that several times before it goes down him each time, that would probably be a good thing.
It would.
So I didn't know you could, a lot of things go and have creams and stuff like that made for them and for children.
For children as well. We talked earlier about flavoring. If it's a medication that's really bitter, pharmacists can flavor the medications now to hide that.
I may even have them do that for me.
It's
well,
true.
and I've talked to a lot of people who have a family member with dementia, and it sometimes becomes an issue where the person can swallow, but they don't want to. They don't want to take that pill, And so what they do is they put their medications in creams, and then when there's an issue and they need to get the medication in them quickly, and they're not wanting to take a pill, they would put it on their hands and rub it on their necks or something, and that would relax the person or whatever.
Oftentimes with their dementia, they're not aware of what you're giving them.
Right.
They may even be a little paranoid and
Exactly.
that you're trying to poison them or whatever it may be. But it makes it difficult to help assist giving that medication. So if you can apply a cream versus trying to...
And they don't know you're doing that.
Yeah.
You're just rubbing their neck.
Exactly.
You
And we do make medications like that too that do help calm people down, and we make it into a cream base form.
So if you have, even if you don't have dementia, if you just have difficulty swallowing horse pills, you can ask your pharmacist, can you make this into a cream or some other...
Even pills that are you have to swallow whole and they can't be crushed, we can make solutions and liquids, so a syrup out of it, so that it's easier for them to swallow something that's a liquid versus a whole horse tablet. We can do that as well.
And it would probably even be good with kids because, they still prescribe pills to kids. And it's difficult when you're a child, when someone says swallow it, You
Mhm.
know, I can swallow this big old jawbreaker, but don't make me swallow a little bitty pill.
Mhm.
You know, your throat just shuts.
Yes.
So that would be a really neat thing.
Mhm.
Um, Talk about some of the other stuff pharmacists do, because when you start, before we started talking here, you were telling me all these things that I couldn't. Really?
Mhm.
You do that? So
Yeah, I mean, when you think of a pharmacist, you think of bringing your prescription into your local retail pharmacy and getting that prescription filled, and that's about it. But there's so much more that we can do. So earlier we had talked about vaccinations. So nowadays you can actually go into your local Walgreens or Rite Aid and get a flu shot. You don't have to wait to get an appointment to see your doctor to get that flu shot anymore. So pharmacists in more than 40 states are allowed to vaccinize. But some states do limit what pharmacists can and cannot administer. In the state of Washington, I know we're allowed to give most vaccines. So flu shot is an example of one of them. And at
and I've
North,
seen that over here in
mm-hmm,
Idaho, the same thing.
exactly. And at Northwest Health, we actually have our pharmacist or nurse go out and administer the flu shots because I know a lot of our folks that live in these adult homes or assisted living, it's not easy to pack them all in one van and then drive them over to Walgreens to get their flu shots. So we'll actually come out to them and make it easier, come out to the facility and give the shot. So it's really quick. They're in and oftentimes some of them might have dementia. At least they're in a comfortable setting, so they're
It's
not
not a
in a
foreign
strange.
place. Yeah.
Exactly. So they're comfortable. They're oftentimes just sitting on their couch or on their bed, and we just give them their shots real quick. So we do offer vaccinations now. So that would include flu shots, pneumonia, shingles, and so on. The list goes on. So we do that. And then the other thing is pharmacists are also going back to where I had talked about dosing, Coumadin or warfarin. Lots of pharmacists are involved in anticoagulation now. So where we actually will monitor it's called the PT INR, and it monitors how much warfarin is in the system or how effective it is. So pharmacists can look at that lab value, adjust the warfarin as needed, and so instead of just going to a Coumadin clinic, there are mobile Coumadin clinics out there too that where they actually come to you and just do a little blood draw, very much like for blood sugars for diabetes, just a little poke in the finger, and that's all that it requires.
Interesting. I want to continue talking about that, but I need to take a break. But we will be right back. Interesting.
Mm-hmm.
So I want to expand on what we were just talking about,
Okay.
and then what? Tell me what you would like to move into, what you would feel comfortable with.
I don't know. Trying to think. I don't know. What do you think, Jason? We covered a lot.
Yeah, we hit on a lot of bases.
Mm-hmm.
I don't know if you want to get into any more depth on pro-time testing in comfort of your own home. The fact that, well, we in particular will be able to dose right on the spot. So
Mm-hmm.
what happens when you leave at the clinic? They fax the
Mm-hmm.
results to
Right,
the
right.
doctor faxes to the pharmacy.
Mm-hmm.
So
There's
by
that
going with
delay.
a program like this,
Mm-hmm.
you'll be able to dose right on site. Not only does it save you a trip,
Mm-hmm. Now, are we saying that where Northwest Health is
Yeah, you can say
doing?
that.
well,
Well,
I
we
have,
haven't quite started it yet, but we're in
yeah,
the.
I wouldn't
Mm-hmm.
say that's
Well,
Okay.
to call us because we're doing
Mm-hmm.
it, but
Mm-hmm.
you,
these are
you could say some places have
options.
available to do this,
Okay.
and then
Mm-hmm.
Yeah,
Okay.
we're not the only Coumadin clinic in town.
No. Mm-hmm.
but at least people know that that option is out there.
Mm-hmm.
Absolutely.
Yep. And then I guess I could go into the roles of pharmacists. Outside of community setting, you have pharmacists in hospitals. You have pharmacists
Okay.
in doing infusion, nuclear pharmacy, and
Oh, okay.
and I can talk about long-term care and elaborate what we do at Northwest Health as long-term care pharmacists.
Okay.
Mm-hmm.
All right. We'll continue then.
Okay.
Okay. You ready? And we're back. Welcome back to the Senior Moment. This is Connie Clark with Home Helpers, and I have Maze Vu with me, and she is with Northwest Health Systems, and she's a pharmacist with them. And so we've been talking about a lot of things I know absolutely nothing about. So it's been very interesting. But you were talking about Coumadin and blood thinners, and during the break, you were saying that in some cases they have mobile clinics that come out. And explain to me what that is and the advantage to it and that sort of thing.
The advantage to it really is faster turnaround time in getting the correct dose of warfarin, or another name for it is Coumadin. So currently right now, if you do see your cardiologist or your physician, they dose your warfarin or Coumadin, and you have that prescription. It has to get faxed to a pharmacy, and then you have to wait for that pharmacy to fill it before it gets to you. Sometimes that's quite a delay, and especially if the pharmacy needs a clarification in the way the orders are written.
Or it's a Friday or something
Exactly.
like that.
Or you're out of refills, but it's a chronic medication that you continually have to take. So to make that turnaround time much shorter, there are mobile clinics out there available that will have pharmacists dose based off of a PT-INR. It's a point of care testing where they just do a quick little poke in the finger and just take a look at that little blood drop of where your lab values are at, where that PT-INR lab value is at. Because if it's, we'll dose that medication based on how high the level is or how low it is.
And for those of you that don't know, this is how thin or how thick your blood is.
Exactly.
And these medications thin your blood out, correct?
Yep.
Which then affects your blood pressure and all of those things. So if your blood is too thick, then it goes through your veins slower, which will affect your blood pressure and could be dangerous. So it's important that if your blood is not at those correct levels, I mean, it could be life-threatening.
It could be. And this medication it has such a narrow therapeutic window, meaning it has such a narrow window of working, so that if it's just a little too high or a little too low, could be dangerous. So that's why that turnaround time is so important, of getting the lab values back. And then not only that, but getting the dose you need sooner rather than later. So if you have a mobile clinic that could come out and do the dosing right then and there after doing a blood draw or a blood check,
that saves a day or two,
Exactly.
could or even longer.
Yep.
I was not aware that there were mobile clinics that did that. My aunt took Coumadin, but she loved her coleslaw, and that would just mess with her levels like crazy, and we couldn't get her to stop eating that, and then she'd stop and it'd go back to where it was, and she didn't have this sort of service that would come out. She'd have to wait till her next doctor's appointment. Meanwhile, her levels are just, going up and down all over the place.
Yeah.
So this would be something really good for those situations.
It would be. And and we're talking here about the mobile clinics, but there are coagulation clinics that are pharmacist driven, where you don't have to go see your physician now. You can just actually go to your Coumadin clinic and see the pharmacist there and get your medication adjusted as well. So there are some mobile clinics out, but the more traditional clinic is the Coumadin clinic, where you actually still have to go and see your pharmacist.
And all these things that we're talking about, what I would suggest if you're interested in any of them is talking to your pharmacist and finding out, do they provide this for you? Because it may not come up in discussion with your doctor.
That's true.
And it might be something you would want to pursue. And in talking about your pharmacist, again, my little skinny view of the pharmacist is the person standing behind the counter at my local drugstore. But pharmacists are showing up all over the place, not just in the local drugstore, right?
They are. So, yes, you're used to your pharmacists in their white coat at your community retail pharmacy, but there are so many more positions and so many more things that pharmacists can do nowadays. We have pharmacists in hospitals, and so there are some pharmacists that will round with the physicians and the residents and actually go in and see patients. There are pharmacists that are less involved, but they are involved in receiving the physician's orders and making sure that the correct medications get to the correct patients. So that involves IV infusions, dosing them, and also making sure that the patients can leave the hospital to an outpatient setting with an equivalent medication. So you're not going to go home with an IV bag attached to you.
Not normally, no.
Normally.
Well, and let me ask you, when we're talking IV bags, if someone is being fed through a feeding tube, is that something that goes through the pharmacist also?
Yes, it does, because the pharmacist has to review, can this medication be absorbed at that site? Because if there is a tube, we have to think about, okay, where is this tube placed in? Because depending on where it's located, the absorption would differ. So we have to think about where the site is and the type of medication, and will it be absorbed? So those are things that pharmacists have to question and review. So yes, it would go through a pharmacist.
Oh, okay. So now we have, and when you said hospital, I mean, I've been in the hospital, and you get medications in the hospital, and my little brain didn't think, oh, there's a pharmacist there, but I guess there would be, because somebody's got to fill those.
Yes.
And you don't really think about it, because when you are discharged from the hospital, they send you with a prescription somewhere. And I guess I always thought that you guys the hospital sent out to some drugstore and they sent it in, but they're actually full pharmacists
Yes.
in hospitals.
Yes.
With all of that.
Yep.
Okay.
Yep. They kind of just float around, but they're there. They're definitely working around the clock, and even they're constantly reviewing drug interactions too, and drug disease interactions and things like that, because patient comes into the hospital with their home medications and physician wants to start a new medication. Well, we want to make sure it's not going to interact with those home medications. So there's that transition into a hospital, and then that transition out of the hospital as well, and pharmacists are involved in that.
And I'm sure, because remembering back, they said, well, what do you mean I can't bring them their medications from home or whatever? But that's because a pharmacist needs to know what all they're taking, and if they have control over all the things they're taking, then they know, versus someone sneaking in their baby aspirin from home or something like
Yes.
that. You would know that and put that into the equation of what they're taking.
Exactly.
And you had said that some skilled nursings have their own pharmacists located also.
They do. Some of the skilled nurses or skilled nursing facilities have pharmacists quite involved. Drug utilization reviews, as we mentioned before, and helping nurses and the physicians as well, making sure that for our older adults as well, I kind of think of them as very much like children, in that your body is going to absorb and metabolize the medications much differently than a younger, healthy adult.
Oh, I didn't realize that.
So in our older adult populations, our liver, our kidneys are not functioning as well as, let's say, in our 30s. And so the way they break down medication is going to alter as well with age. Our body composition does change as we get older. We've got, unfortunately, more fat tissue, less muscle mass as we get older, and that alters the way we absorb our medications and where our medications actually stay in our bodies. And so, those are all things that you have to think about when you're a pharmacist, is who is my patient? And you have to look at them with a holistic approach. Who are you treating? Not only just age, but also cultural backgrounds and religious backgrounds that they come from, because that might alter if they're going to continue to take their medication. Because if you don't believe this medication is going to work for you, you're not going to want to take it. So pharmacists oftentimes are that median communicator between the physician and the patient, because we have to take really, I guess, in-depth information. You know, if you've ever had physicians speak way over your head, you know, you have to take that information and then be able to relay it in normal layman terms to your patient. And so you got to be that median communicator where, you know, you got to take this really advanced knowledge, bring it down to a level that your patient can understand, so that they can understand why it's important for them to take and believe that it's going to work for them. Otherwise, you know, what's the point? They may not even continue taking on that medication.
And a lot of times when you're taking a certain medication and you start feeling better, you think, oh, well, I'm okay. And so you stop, you know, and then all of a sudden all the symptoms come back and you go back to the doctor going, I don't know, I took the medication and look what's happening. But, you know.
Yeah, and oftentimes you're treating something that you can't feel. High blood pressure, for example. So you're taking blood pressure medications. You can't feel when it's really, really high, or you may be, I mean, if it's really high, you might feel headaches or
But
things like that.
almost approaching there, not necessarily.
Yeah. So that's a perfect example of why folks might not take their medication, because they don't feel any different. And it makes sense, you know, growing up with my culture background, where my grandparents only took medications that they felt like made them better, and refused to take their other medications because they felt no different. They were used to taking antibiotics that was a quick fix, you know. So then if they took high blood pressure medications or diabetes medications that didn't make them feel better right away, then what was the point of taking them? So, you know, a role of mine is to help educate my community about that. And so pharmacists are also just educators in general.
And that's why you always see that consultation little desk when you go to the pharmacist. You know, you can drop off and pick up, and then the consultation's in between.
And definitely take advantage of that. I don't think enough people take advantage of that. You know, when I hand them the prescription, do you have any questions for me? They say no, and they're good to go. And maybe that's not the best way to approach somebody too, is if they have any questions, but just go ahead and start opening conversation about
Start
this
talking about
medication.
it.
Yeah, exactly. Because then that's going to open up questions that you might have that you never knew you had about the
Well, and
medication.
especially when you were talking about the holistic type of herbs and things like that, I mean, I don't think twice about going in and having a chamomile tea at night, you know, before I go to bed. But that for someone else might interact with something they're taking and not even think about it and not know it, you know, because it wasn't something they were drinking when they got the medication to begin with, you know. And so it's hard to think, okay, I'm thinking of buying some tea. Do I need to ask my pharmacist about? But that you really do, especially because of a lot of the different herbal teas, and now we take all kinds of herbal medications because they're supposed to make us feel better or look younger or
Yep.
whatever, you know.
Supplements. And in today's world, I think it's funny, you throw the word anti-aging on anything and everybody starts taking it. But it is something that, just because it's available over the counter, doesn't mean it's benign, doesn't mean it comes without potential side effects or drug interactions.
And those things are not required by law to have those on them, those bottles.
Yep,
Versus the medications that you get from your pharmacist. It is required.
it is.
So if you get the medication first and then get the herbal remedy, you're not making that connection, if that makes
for
sense.
example, if you don't tell your pharmacist, well, you know, you're picking up your warfarin, your blood thinner, and then you're also purchasing some low-dose aspirin over the counter. Now, if I, you know, saw a purchase of that together, I would definitely bring up that potential, because the aspirin could increase your potential for bleed in addition to taking it with the warfarin. So I would definitely bring that up. But if you purchase them separately, I would never know to ask that, especially if that aspirin was not on your profile.
And that's interesting that you bring that up, because I brought my aunt up, the one that was on the blood thinners. And as long as I could remember, when my aunt when someone there had a headache or something, she had bare aspirin sitting there. She never took Tylenol. She never took Advil. She never took any of those. She took regular aspirin. And now thinking back, during the latter part of her life, she was on Coumadin, and oh my gosh, that aspirin was still sitting in that counter. And if she took both, that was a major no-no, because that was full strength aspirin, not low dose. But I didn't even think about it yet. I know you take low dose, that's interesting.
So yes, definitely those kind of things that you don't think about.
Well, and you don't take it every day. So when you're saying, what do you take? Well, I don't take anything except when I have a headache.
Yeah, exactly.
That except is not there. Very interesting.
Yep.
Very interesting. And one of the other things that you had mentioned was nuclear medicine, and I know absolutely nothing about that. So I want to take a break, and I want to find out what in the world that is.
Okay.
And how pharmacists interact with that.
Sure.
So we're going to take a break, and we will be right back. We're doing good. And she's doing very good.
I hope so.
Yeah, I just remembered that when you said that, because she never took anything but bare aspirin.
Yeah.
And when she died, and she was on Coumadin then, and we cleaned out her counters, there was a bottle sitting up there, and it never even, and I knew better, that it never even was gone.
Yep. So, and that's the thing; it won't show up on that lab test that we had talked about, where it
Unless she had just taken it.
Well, even still, because the aspirin works on platelets, so blood platelets, so to thin the blood. The warfarin works on breaking down clot. So they're both blood thinners, but they're different types of blood thinners. So she was taking the aspirin and the warfarin, and the warfarin was being monitored, and if she had never told anybody that she was taking the aspirin, we would have never known if she had a bleed.
Yeah.
Then generally that's too late when they're having a serious bleed.
Wow. Interesting.
Yep. So yeah, we can talk about nuclear pharmacy, and then
I don't know what that is.
The compliance of it all, why it's so important to follow when they say every day, take it every day. The studies
Okay.
that are based on, being compliant with the regimen.
Okay. And nuclear pharmacy is just a particular type of pharmacy. I don't know too much about it, but we can talk just about what it is.
Yeah. Yeah. That's
Okay.
all. Okay. Ready? We'll go in for the last segment.
Okay.
See, we've just been sitting having a conversation.
Yeah, we're already almost done.
Okay. And we're back. Welcome back to the Senior Moment. This is Connie Clark with Home Helpers. And this afternoon in the studio with me, I have Maze Vu with me, and she is with Northwest Health Systems. And they're actually located in Spokane, but they do service the North Idaho area. And she's a pharmacist with them. And we've been talking all about all the different issues, things that I never even dreamed of, having to do with what pharmacists do and how they can help us. And one of the things you had mentioned during one of the breaks was nuclear medicine. And in my little brain, I see the little atom and the little things swirling around it, and that's my idea of nuclear medicine, but I have no idea what is that. So what is nuclear medicine?
Well, nuclear medicine and nuclear pharmacy is a very focused type of pharmacy, and it is involved much more with medications that are radioactive, and making sure that those medications are maintained appropriately because they are radioactive. So I haven't been personally involved in nuclear pharmacy, but I know it's an example of a very specific type of pharmacy.
Is that like cancer medications? Is that what that is? Okay.
Yeah, and that's just one example, but there are so many other things out there too. And so nuclear pharmacy is just an example of a specific type of pharmacy, but other specific types of pharmacy would be involved in oncology with cancer or chemotherapy drugs. You have pharmacists very specialized in that and much more knowledgeable and understanding of the types of cancers out there, the types of treatments available, the side effects associated with those medications.
So when you go to pharmacy school, I'll say for lack of knowledge, you could go off to different disciplines just like you would if you were a doctor wanting to go to pediatrics versus oncology. You would go off in different directions?
Well, when we start pharmacy school and we graduate from pharmacy school, we all have the same general knowledge. It's after pharmacy school, very much like med school, where after med school, you can decipher from there what focus you
What
want.
specialty you want.
Exactly.
Oh, okay.
Mhm.
Okay.
So it would be after pharmacy school. And then pharmacists, not a lot of folks are aware, but pharmacists, a lot more are actually doing residencies where they are choosing a particular specialty and studying very thoroughly in that. So, for example, after I was done with pharmacy school at Washington State, I went and did a geriatric residency where I focused on older adults, the changes involved with older age, and then also the changes that would happen with taking specific medications as you age, how that is altered. So, and then also, with older adults, they're on so much more medications. We call it polypharmacy when they're on that, 25 or so.
Yeah, I've seen them 20, 30
Exactly.
medications. Yeah.
So, for example, I did my residency in geriatrics, but you can do 1 to 2 years postgraduate or post after you're done with school, and but it's not required like how it is for physicians.
So it might, if you're a senior and you're getting your medications from a pharmacist, it might be a good idea for you to find out if they've gone to those kinds of classes, that they would understand the interactions and the different absorption rate, to be able to communicate with you what you're taking and how it affects you as you get older.
Exactly. Yep.
Do they have that same type of thing for pediatrics?
They do, because pediatrics involves infants, newborns to adolescents.
So you're talking little bitty doses versus the okay.
And it's scary because there's actually 3 times the rate of a potential medication error in pediatrics. And so that would require a lot more expertise and understanding of your patient and the medication, the doses. So that's a perfect example of a subspecialty that a pharmacist could focus in.
So it might be a good idea if you're going to a pharmacy and you have either a senior or a child to ask those questions so that they would be able to catch things, and know how things are going to act. Interesting. I didn't know that.
Yeah, so this is just examples of specialties that pharmacists can go into. Transplants, for example, those transplant medications. You have pharmacists that are much more involved in understanding those specific medications for, let's say, a kidney transplant versus a general pharmacist. They would have more knowledge in that. So that is something to look for, too, if you have a pharmacist, is also if they have any subspecialty focuses that they have. So, and then other things that pharmacists are involved with in today is academics, faculty, teaching, politics, some pharmacists are very much involved in legislature and everything, and that's important because that keeps our profession ever evolving.
And you would probably have to know when new drugs come out on the market, again, what interactions, what they're comparable to, that sort of thing. So there's new drugs coming on all the time, so you would have to keep yourself up to date on all those things.
Oh, yes. And, with the baby boomer population now getting there, and more prescription drugs available, pharmacists really have to keep on their toes with the new, ever-evolving profession and knowledge that's available out there. So, yeah.
And one of the things that we talked about during the break also was talking about compliance. And we were saying, there's a lot of seniors that take 20, 25, 30 medications, and it's very confusing for them sometimes. Now which ones do I take in the morning and which ones do I take at night, and why am I taking all these things and I'm not really sure. It's really important that they do exactly what they're supposed to because you're assuming they are when you're
Yes.
looking at those interactions and all of that.
Mm-hmm.
And if they're not taking them like they're supposed to, you don't know that, and you can't tell if there's a problem or not.
And it's not just us. For a physician example, for example, if your blood sugars are not being controlled, they're assuming that you're taking your medications as prescribed. So they may
They're going to give you more stuff.
exactly they may up the dose on your insulin, and that might cause a problem with your blood sugars getting too low when you're actually taking it. So that's a perfect example. So it is important to be adherent with taking your medications. And I know it's difficult to remember to take them because I can't even take a multivitamin. I can't even remember to take my multivitamin on a daily basis. But I've come across people who have developed systems that work for them. And that's the interesting thing, is that you need to just develop a system that works for you, whether it be bubble packing your medications, having them bubble packed by a pharmacy. And bubble pack means, you have a blister card with one tablet in each bubble for each day, and you have all your AM medications in, or they're listed as AM medications on that card, and your PM medications listed as PM. And so, whether it be bubble packing, I've seen people who have used those fish tackle boxes, and they put their medications in there. And yeah,
It's funny that you mentioned that because I've seen, the little containers that you put your pills in, and they're these little bitty compartments, Well, that won't even fit 3 of my vitamins. But mentioning your tackle box, exactly. That is perfect.
yeah, because each drawer is, signified for a specific time of the day.
Right.
And so, and that's worked fine for them.
Those would handle all those pills. Oh,
yes.
that's real. I never thought of that. That's really neat.
I had one lady where I did a home visit, for consulting, and I asked her how she placed her medications. She placed them all in one basket. And we went through them, myself and my pharmacy student, just to see what medications she was on. Some of them were upside down. She had empty boxes in there that she could have just thrown away. They were empty inhaler boxes. And then I came to ask her how she knew what she had just taken and what her system was, really. And so she explained to me, if she'd taken her medication, she'd flip it upside down, the vial. So she knew that she had taken those. The empty box was her divider, so it divided her AM meds from her PM meds. So that wasn't just garbage. And it's funny because to me, when I looked at it, I just thought it was all
Mixed up.
Exactly. But she had a system, and that system worked for her. And then for me, I've come to realize that my system is that I need to have my multivitamin sitting in front of me. So it's sitting on my, right in the shelf where my doorway is. So before I walk out the door, I see it and I realize that I still have to take it. So that's really, I think what helps with adherence is developing a system and also an understanding of what the medication is for. And that's where pharmacists can come in, is to help you also, manage your medications. You could take all these all together. That's fine. And also to help you have a better understanding why you need to take that medication. Oh, it's for my heart, for my blood pressure.
Understand, and even just write on the label if you can't remember what that's for. Heart,
Yeah.
BP, whatever. One of the things that I have seen walking into people's homes is old medications. I've walked into homes where there's a stack of bottles in the kitchen, and you walk into the living room and there's a stack of bottles next to the chair. Then you walk into the bedroom and there's a stack of bottles next to the bed, and you walk into the bathroom and there's a stack of bottles there. And you're going, oh my gosh, how do you know what you're taking, when you're taking it? And there's old stuff here and there's new stuff here, and that's really scary. But I have seen it so many times.
And people don't like to waste them and throw them away because
I might need it.
I might need it. I might get sick again. I might need a refill on this, so I need this information. And you're right. There are unnecessary medications. I know I went through my in-laws, their medication cupboard, and they had...
You're probably a bad person to have for a daughter or daughter-in-law, because you'd be scoping out everything I took.
Yes. They had samples of Vioxx, and Vioxx is a medication that was pulled off the shelf a few years ago, quite some years ago, before I even started pharmacy school. But they still
Oh my
had,
goodness!
yeah,
Just in case.
yeah. Well, it was pulled off the shelf because they found some post marketing evidence that it wasn't so safe.
But they had it just in case, right? Oh,
And I
geez.
was like, what is this doing in here? But yeah, so in that case, medications after their expiration date, look at the expiration date. They all have to have an expiration date. You can just dispose of them in the garbage. I know in the county of Spokane, we disintegrate all of our garbage there, so you can just dispose of it in a way that's not accessible to someone. So, mash it up with kitty litter or your coffee grounds.
Oh, that
Yeah.
sounds enticing.
Yeah, so that nobody gets into it. Make sure you pull off your labels off the vials because it has all your personal information.
Oh yeah,
So
absolutely.
with the problems we're having with identity theft, you want to
Those
make
things
sure.
need to be shredded. Don't throw them away with the bottles.
Exactly. So I know people used to dump them in the toilet, and that's no longer recommended.
Because that goes into our water system.
Exactly. And it's crazy. They the trace amounts of estrogen and things like that they find in fishes and
Oh,
things like that.
my.
It is dangerous to our environment. So you can just dispose of it in your garbage. At least I know in the county of Spokane. I'm not for sure in Idaho.
Well, and I think I've seen in Idaho where they've had certain days where you can bring in your old medications to get rid of them.
Yes.
That way you don't have to put them in the trash or anything like that. Just take them in there and they'll take care of them for
Yeah.
you.
They have take back days.
Right.
There are some pharmacies, Group Health, for example, they have a drop off that you can just throw away your old medications, just dispose of them there.
And maybe just check with your pharmacy and see if they have some sort of program to do that.
Yep.
Well, you are just so full of information. Every time I have someone like you in here that it's so interesting. I find out all these neat things. But if someone wanted to find out more information, I know you all are over in Spokane, and it's Northwest Health Systems. The website for them is NW for Northwest, HS for Health Systems, RX for prescription. So it's nwhsrx.com. And I've got an 800 number here because if someone has a question or something, they can always call. I know there's going to be people there that can answer their questions if they can't find a pharmacist or someone that can help them. And I've got a number here. It's 800-713-4189. And any parting words of wisdom for us?
Oh, well, just thank you for having me here today. So,
Well, I appreciate you being here. And if you've been listening to this interview and you think someone else you know or love would really love to have this information, they can go on our website, coeur d'Alene-homecare.com, in just a couple weeks, and I'll have this interview online so you can share this information with your family and friends. I'm hoping that it can help somebody. And if we can just help one person out there that's confused or dealing with some issue, then it's well worth it.
yes, I agree.
So thank you, May, so much for being with us this afternoon. And you all have a wonderful, warm rest of your weekend. Good day.